A man in his 80s has died in a Sydney hospital after testing positive to COVID-19, making him the third coronavirus-related death in Australia. He was also a resident at the Dorothy Henderson nursing home, where a 95-year-old woman also passed away after testing positive for the virus.
A man in his 80s has died after contracting the coronavirus in the Dorothy Henderson nursing home here in Sydney's northwest. The nursing home is run by Baptist Care. It's the second death from coronavirus here at the Dorothy Henderson Lodge. Last week, a 95-year-old resident died from the coronavirus, and 11 people who visited here or worked here are currently in self-isolation. It's thought that the virus may have been carried by a worker here, a health worker here in her 50s. She is a much-loved member of staff who has been working with the residents in this nursing home for the past 20 years. New South Wales Health has expressed its sympathy to the families of both the man in his 80s and the woman who was 95 when she died last week. This brings the death toll from the coronavirus to 3. And here in New South Wales, 7,216 people have been tested for the virus. Almost 500 cases are still under investigation, and 38 people have tested positive. Now, New South Wales trains are stepping up cleaning efforts and public health messages because of the millions of passengers travelling on New South Wales trains every day. They've had extra cleaning staff out today to try and disinfect, decontaminate the trains that are on the network.
Philippa McDonald reporting there. The Australian Medical Association is backing calls for the Victorian Health Minister to apologise to a Melbourne GP who treated up to 70 patients before testing positive for coronavirus. Dr Chris Higgins was criticised by Health Minister Jenny Mikakos for attending work despite presenting with flu-like symptoms. In a statement today, Ms Mikakos said everyone, including healthcare workers, has a responsibility to prevent the spread of the virus, and it's important to not attend work if you are unwell. The doctor hit back at the Health Minister, calling her comments unfair and inaccurate. He wrote on the Minister's Facebook page that he only presented with mild cold symptoms, which had almost subsided when he returned to work the following week. The AMA President has defended the actions of Dr Higgins, saying that he got tested for coronavirus even though he did not meet the criteria for the infection.
I believe an apology is appropriate in the circumstances. The doctor acted within all the available guidelines and information from the authorities and made an informed decision, made a decision in good faith to attend work. And it was really quite unhelpful what the Minister did say yesterday. Coronavirus can be a very, very mild condition. Clearly, the doctor was recovering from that, but the symptoms obviously were out of consequence with the actual infection itself. We can have people clearly with almost very, very, very mild conditions who will be not picked up because of, unless there's any other specific risk factor, will not be tested or picked up and indeed diagnosed as having coronavirus. We know that one of the situations from overseas is there's clearly a very large undiagnosed component in the population, which makes the understanding of the virus even more challenging than it is. This is one of the reasons why it's important to get the facts and the information before commenting.
West Australian health authorities have confirmed another case of coronavirus, bringing the state's tally to 4. The woman in her 70s arrived in the state from Cuba on Thursday aboard flight QF10. She attended a West Australian Symphony Orchestra event last night before she knew the outcome of her test results. She's since been isolated in her home. WA Premier Mark McGowan says efforts are underway to determine who she might have come into contact with.
We are now tracing all of the places and events that she went to, so we can publish that information and make sure people are informed if they are at those places or events, and they can take appropriate precautions in relation to those matters. She is now self-isolating at home, and she is being checked on regularly by the Department of Health. She's from the western suburbs. That is the current status of that situation. I'd urge everyone across Western Australia to listen to the advice, to use common sense. Don't panic. Take the advice of the health professionals, and if you get advice, please follow it in these circumstances.
Tasmanian health officials have expressed frustration that a man who later tested positive for coronavirus continued to work at a major hotel while waiting for his test result. The man, aged in his 20s, travelled from Nepal to Hobart last month before experiencing cold-like symptoms. He continued to attend his vocational college and work casual shifts at the Grand Chancellor Hotel in Hobart. He tested positive late yesterday and is in a stable condition at the Royal Hobart Hospital. The state's health minister says it's disappointing the man didn't follow the advice of health officials to self-isolate.
It's unacceptable. We want to see Tasmanians kept safe, kept healthy, so it's unacceptable that you do not follow the advice. And indeed, today I've asked the Director of Public Health for further advice on whether or not we need to strengthen measures to ensure compliance with self-isolation. So with regards to people that have been identified as close contacts, they have either been contacted and are in self-isolation or in the process of that happening. Further investigations are happening as we speak, and further interviews to determine whether other Tasmanians are counted as close contacts, and if there are further close contacts identified, they will be provided with advice and the direction that they must self-isolate to.
Italy's Prime Minister has announced a sweeping coronavirus quarantine, imposing restrictions on the movement of about a quarter of the country's population. At least 16 million people are now in mandatory quarantine in Lombardy region, as well as in a further 14 provinces in a bid to contain the outbreak. The measure will close gyms, pools, museums and ski resorts until early April. At least 230 people have died in Italy so far, making it the worst affected European country. The Prime Minister, Giuseppe Conte, says the restrictions are a necessary sacrifice.
Noi vogliamo garantire la salute dei cittadini.
We want to protect the health of all citizens. We're aware that this will create unease and that these measures will mean sacrifice, both big and small. But this is the time to be responsible. We must all respect these measures and we should not try to dodge them. We must think about protecting our health and the health of our loved ones.
Pope Francis will live stream Sunday prayers from inside the Vatican rather than appear in St Peter's Square as usual to avoid encouraging a mass gathering amid the coronavirus outbreak. The Pope's general audiences will also be streamed and there will be no in-person participants at Papal Mass until at least the 15th of March. The Pope has been suffering from a cold, but the Vatican stresses it's not coronavirus. At least 6 people have died in the collapse of a hotel in the Chinese southeastern port city of Quanzhou. The 5-storey building was being used as a quarantine facility for people who'd come into contact with people infected with the virus. State media says more than 40 people have been rescued from the rubble, several of them seriously hurt. At least 20 others remain missing. The Grand Princess cruise ship is still idling off San Francisco, waiting for US officials to decide where it can dock. 21 passengers have tested positive to COVID-19. 3,500 people are on board, at least 4 are Australians. Another ship that shared crew with the liner is also being monitored.